Welcome back to the Community of Innovation podcast, brought to you by the Center for Aging and Brain Health Innovation, otherwise known as CABHI. I'm Allison Sekuler, President and Chief Scientist at CABHI and at the Baycrest Academy for Research and Education.
And I'm Rosanne Aleong, Executive Director of Research, Innovation, and Translation at the Baycrest Academy and the Director of Research, Innovation, and Translation at CABHI. May is Mental Health Awareness Month. So today we are talking about recent innovations and research related to mental health. Specifically, we are discussing neuromodulation, a broad term for interventions that work by stimulating directly the human brain. Brain stimulation has been used in healthcare settings to treat a variety of health concerns, from chronic pain to mental health conditions. And now there's growing research in how brain stimulation might be used with individuals at risk for or living with dementia. Our hope with today's episode is to shed light on what brain stimulation is, what it isn't, its potential for impact, as well as break through some of the stigma around the use of brain stimulation in healthcare. Okay, Allison, two amazing and so appropriate guests for Mental Health Awareness Month. What stood out for you?
I think what stood out for me was, in one word, just hope. We keep hearing that there's no hope for a cure, there's no hope for treatment. But what I heard today is that there is hope. We may not be there yet, but this approach of brain stimulation seems to be able to provide some relief in some ways that other kinds of treatments might not. And it might do even better, we were hearing, if you start combining it. So if you combine brain stimulation with certain sort of drug treatments or lifestyle changes, putting them all together, that's where I see great hope. What stood out for you?
So my word is generosity. Our person with lived experience today was so generous with her time, with her story. But when you hear her speak about her experience with brain stimulation, she's really wanting to share her experience for the betterment of others. So she is encouraging other persons living with mental health conditions, researchers, clinicians to really embrace moving things forward and paying things forward. And so I feel like generosity is what stood out for me, particularly from our second guest.
Yeah. I think the other thing with the second guest, I don't have a word for it, but it's just her desire to help to break down some of those stigmas that you mentioned. Stigmas around, mental health, stigmas around the use of brain stimulation in healthcare, and people will see she's described, some of the fears around these things and how once you experience it and you can see how life-changing it can be, it really changes your perspective on all of these issues. So let's get to the show. Our first guest is Dr. Tarek Rajji, a geriatric psychiatrist and senior scientist at the Center for Addiction and Mental Health, or CAMH, and is a professor of psychiatry at the University of Toronto. His research focuses on enhancing cognition in older adults with dementia or at risk for dementia using brain stimulation and clinical neurophysiology alone, or in combination with other interventions. He also studies standardization of care for individuals living with dementia. In recognition of his research and teaching activities, Dr. Rajji has recently received several local, national, and international awards. Currently, he's serving as the chair of the Medical Advisory Committee at CAMH, and at the University of Toronto, he was appointed as the executive director of the Toronto Dementia Research Alliance in 2020. And he's also the director of the Geriatric Psychiatry Division since 2022. And he holds the Canada Research Chair in Neurostimulation for Cognitive Disorders. Tarek, welcome to the Community of Innovation podcast, and thanks for being with us today in honor of Mental Health Awareness Month.
Allison, thank you. And Rosanne, thank you very much for having me here. It's really an honor to be here on this amazing podcast.
So let's get started with just the basics. So some of our listeners might be hearing for the very first time about these concepts of neuromodulation or brain stimulation. So can you give us a little bit of background about what is brain stimulation? What are the different kinds of brain stimulation and how might they be used?
Yeah, that's a great question. And there are many terms that can be used sometimes as brain stimulation or neuromodulation or neurostimulation. So I may use them interchangeably, like during our podcast today. It really it's a wide umbrella of several technologies that aim to directly stimulate the brain, either via electrical stimulation or magnetic stimulation, like with EMS, or sometimes with mechanical stimulation, like with focus ultrasound. Some of the older forms that people may be aware of is something called like electric convulsive therapy, which is a ECT, which is a old form of treatment for effective treatment for treatment-resistant depression. But that's a unique form of brain stimulation that requires anesthesia. That's not the case for most forms of the neuromodulation technologies that we're studying now, that we'll be talking about them now. Another form of brain stimulation called deep brain stimulation, and that requires typically surgery. Neurosurgeons implant electrodes in the brain, again, to treat certain conditions. A classical one kind of treating, for example, tremors and Parkinson's disease. So that's a spectrum of kind of uh, range of different types of neuromodulation interventions.
So just to be clear, when you talked about directly stimulating the brain, it's only that deep brain stimulation that requires the surgery and there's an implant in the brain. The others are happening outside of the head, right?
Yes, so they are directly in a way that there is no, it's not there is a drug that goes throughout the body and then reaches the brain. So it's a stimulation from the individual is awake, and there is an external stimulation, either the magnetic stimulation across the scalp and then to the brain, or electrical stimulation. Yeah.
So I'm going to dive a little bit deeper and ask, so what exactly is happening in the brain when it's stimulated this way? So you're saying it's happening typically outside the head. It goes through the scalp, I guess. What does the current research tell us about how this stimulation impacts brain structure or brain function?
Yeah, it's another great question. It depends on the form of stimulation that we're using. But typically, for example, with electrical stimulation, this is when we're delivering a direct current to the brain, just either a DC or an alternating current. If people may remember from basics physics, AC versus DC. So with that form of stimulation, typically what we have is either excitation of the brain tissue under the electrodes over that we're placing uh, over the scalp, or inhibition. So we could, depending on whether it's a cathode or an anode, again, some basic, physics, electrical terminologies that result in either excitation or inhibition of the tissue underlying it. With TMS, for example, also it can cause an excitation or inhibition, but also it can cause the cells of the brain to fire, to generate uh, what we call action potential. So that's the neuron itself is firing. All that relate also to the concept that all these mechanisms, whether it's firing of the brain neurons or inhibition or excitation or other kind of changes, affect what we call the neuroplasticity of the brain. And what do we mean by neuroplasticity is this ability of the brain to change itself, to adapt to either disease states or external form of interventions like forms of neuromodulation. So the therapeutic effects of these interventions are thought to be related to the changes in neuroplasticity in the brain.
So essentially, we're activating or kind of, I don't want to use the term, but turning off, I guess, parts of the brain using this stimulation.
So yeah, so the idea is that if an area of the brain needs to be activated to function better, that we do excitatory form of stimulation, or if there is a brain that we believe it's hyperactive and that's what's causing symptoms, then we use inhibition of that region to reduce the symptoms.
And I know some of our listeners might be wondering, what does it feel like to have your brain zapped in these ways? That's a technical term, I guess. I have done it myself, obviously, and I know you have as well, many times. So maybe you can just explain. It doesn't really feel like we might have seen in the movies electroshock convulsive therapy, and that's what people are maybe picturing. Can you just describe what would it feel like to have one of these approaches for neuromodulation?
Yes, it's completely different electric shock therapy because, like I mentioned, with electric shock therapy, the individual has to be anesthetized. They are not awake. They are getting something completely different. But when we talk about electrical or magnetic stimulation, really the brain doesn't feel anything, right? So you're not feeling sensations from the brain. What you may feel is sensation from the skin, from the scalp, either tingling of the skin, or sometimes you may feel the pressure from the pulses, the magnetic pulses. There should be no pain, there is no painful sensation, and it's mostly, I would say, with electrical is tinkling. Some people may experience slight headache, kind of after being under the magnet for some time, but it's just minor, and that resolves either on its own or just by some over-the-counter analgesic.
Yeah, and I wonder if you can tell us a little bit about the research that you've been doing when it comes to brain stimulation. So we know, for example, you've developed some new approaches to brain stimulation in the areas of dementia and depression. And I'm wondering how effective are those treatments compared to different kinds of medications or other therapies?
Yeah, thank you for asking that. So we just completed a almost 7-year study. That was a randomized controlled trial. The goal was to slow down cognitive decline in older adults with depression or with a condition we called mild cognitive impairment, or MCI. So these are individuals who have difficulty and on testing their memory, but they're still independent.
It can be a precursor to dementia.
It can be exactly a precursor. So both of these conditions are increase the risk of dementia. So depression, specifically, we know it can double the risk of dementia. So we're talking about mental health and cognitive impairment. So that's a well-known now risk factor for dementia. So the goal was that can we prevent cognitive decline in those individuals over a period of up to 7 years by using brain stimulation. So we use electrical form of stimulation and combined it with cognitive training. So these are computerized exercises that people were coming to classes, and they are doing the exercise in a class format while getting brain stimulation during the first half hour of the 2 hour class, basically.
What kind of
And
training would it be? Like, what's an example?
so examples would be it's like games basically on a computer, and they are learning how to improve their performance on these games. But at the same time, they are learning the strategies of how to resolve those games and how to implement those strategies in day-to-day life. And the idea of adding brain stimulation, neuromodulation to this is to improve neuroplasticity of the brain so that they could learn and benefit more from these computerized exercises than without neurostimulation. So we did complete the study over, as I mentioned, the median, so about the average period of follow-up, and the period of the intervention was 4 years. It was up to 7 years. And what we found is, this is, we're very excited about these results, because what we found is that when we look at the whole group, so people with depression, with or without MCI, plus the MCI group, we can delay cognitive decline by about 2 years. And if we look at the depression only group who don't have cognitive problems or are not having cognitive problems, we can delay the cognitive decline up to 4 years. And if you have depression plus some cognitive problems, then you can delay it for 3 years. So the reason why we're excited about this is because to date, we don't have any treatments for depression that can reduce the risk of dementia or cognitive decline. We have some great treatment for the depressive symptoms, so when the sadness, the symptoms of the depression itself, but we don't really have treatment that could improve cognition or can delay kind of or reduce the risk of dementia. So this could be an exciting new form of treatment for people with depression who are at high risk of developing dementia.
So just to be clear, the treatments that you might have for people who have, say, mild cognitive impairment and depression, this is really the only one you think that's working right now? Or are there other kinds of drugs or therapies that might work just as well?
For depression specifically, we have a lot of, as we have a lot of drugs and form of brain stimulation that treat the depressive symptoms. So the sadness, the lack of appetite, the sleep problems. But those individuals who entered this study did not have acute symptoms of depression. They've had history of depression, which still, even though they have history of depression, they are at a higher risk of developing cognitive decline and dementia. So for that risk specifically, for the cognitive problems of depression, we really don't have now any treatment to reduce that risk. But going back to the neuromodulation specifically for depression, there are now well-established treatments that have been available for decades that are clinically available. So people don't have to access them only through research studies that are effective treatment for depression, as effective as medications. They are not funded by our government yet in Canada, but they are clinically available. They are funded in other jurisdictions.
Yeah, and the other thing I just wanted to mention, because people might be saying, well, it's not preventing dementia necessarily or cognitive decline, but it's delaying. But people need to realize that that's really important too, right? Because if you can delay the onset of dementia by 5 years, you can reduce the prevalence of dementia by half. So just delaying it makes a huge difference, not only in one person's life, but in society as a whole. Is that right?
You're absolutely right. That's delaying cognitive decline, delaying the progression has a big impact on the incidence, as you mentioned, but also on the quality of life of those individuals. The average age in our sample was early 70s. So if we can delay that progression by 4 years, so that's a significant benefit to the individual, but their families and society.
So, Tarek, you mentioned the combination of like the cognitive therapy plus the brain stimulation. Allison didn't mention, but she actually works on another podcast called Defy Dementia, where they talk about other lifestyle modifications like
You work on it too.
exercise. I know, but I'm going to plug you anyway. Diet, exercise, sleep. Can you like combine the brain stimulation with other lifestyle modifications? Like you mentioned this cognitive training, these games. What happens when you combine it with other lifestyle modifications? Do we know?
We don't know. We don't have very large studies around this, but to me, this is a very exciting kind of potential future direction for this kind of work. So there are well-known studies that have shown by doing what we call multi-domain, or so, which means that multiple forms of intervention. So it could be exercise, cognitive training, managing diet. So all these can delay or again cognitive decline. So by adding neuromodulation to these type of intervention, maybe we can optimize the benefits from these other treatments. And the advantage of the electrical form of stimulation that we use, for example, in the study I mentioned, is that it can be portable. So we've done some work where people don't have to come to a center to receive the treatment, as we do, for example, with EMS, but we actually trained the caregivers to be able to deliver and place those that electrical stimulation to the individual with the who's the participant, and actually deliver also the cognitive training. So that these interventions, what's nice about them is that they can be scaled up, to be delivered at home. People don't have to come to specialized centers to receive them.
And that would be so important for families that live in maybe rural areas or remote areas.
Absolutely, yeah. Even if you live in downtown, for the traffic in downtown, that could be an
Fair.
advantage. So.
Fair. So I guess my next natural question is, how does one know if they're a potential candidate for brain stimulation? You mentioned it's not necessarily covered by the government right now, but what factors come into play when determining if brain stimulation is for you?
So when we're talking about depression, for example, on its own, so when people are having an acute episode of depression, they could be technically eligible. So they just reach out to a clinic or either a clinical setting or a research setting to determine whether the person is eligible. These treatments tend to be well tolerated. So in general, most people would be eligible. A typical condition, for example, where people could be excluded from those form of treatment is if, let's say, if they have a metal piece in their head, whether it's because of an accident before or some surgery. So these could be, we don't deliver brain stimulation for individuals who have metal pieces, but in general, they tend to be better tolerated than medication because, as I mentioned earlier, you're not exposing the whole body to the form of treatment. It's just directed to the region of the brain that you're delivering the treatment to. And then there are certain, depending again on the form of brain stimulation, we talked about several conditions, several forms. There may be some specific criteria. So I would say, if you're wondering whether you're eligible or not, just reach out to the clinic or reach out to the research program, and they usually, that usually there's a pre-screen that happens typically over the phone. But in general, people who have maybe seizure disorders, epilepsies, they may not be eligible. Also, there are certain forms of medications that we typically people are, if they are on them, they don't enter those studies unless not because they are safety concern, but more because they could inhibit the benefit from these treatments. So high dose of sleeping medications but these things can be discussed with the treatment team to see if the dose could be reduced, to be able to access some form of treatment.
So I think, we're going to put in our show notes and at the end of the show where they can contact the research team so they can learn more. Is that a good way to prepare people for action later?
So if people are interested in neurostimulation studies, on studies in general about cognition or dementia, maybe I'll put a plug-in for the Toronto Dementia Research Alliance. So you can check our website, and we have a platform where people can see all the studies happening in Toronto environment across the network. And they could check the studies and put in their information that decide to look into them.
So if someone goes over to that website and applies to be in a study and is told, yes, you are an ideal candidate for brain stimulation, whether it's for a clinical purpose or for research, but they're worried about the potential safety issues or side effects, what would you say to those people?
Yeah, and so first, if they go to their website, they would be connected with the study that they may be more suitable, and then they would go through an extensive kind of screening for that particular study. As I mentioned, typically those treatments are very well tolerated, and they will be monitored very carefully if they become eligible, and they start the treatment. They would be very carefully monitored by the research team, and they will have access to the research team on a 24-hour basis if any symptoms or side effects are noticed. Um, but yeah, in general, they tend to be very well tolerated treatment.
So, in terms of safety, there already are some brain stimulation neuromodulation devices out there on the market just for general consumers. So, for example, CABHI, recently supported a company called Roga, which is an electrical stimulation device that is meant to reduce anxiety or stress. If someone is in Shoppers Drug Mart or Best Buy or somewhere and sees one of these devices, what is it that they should be taking into consideration?
I'm not familiar with that specific kind of product itself, but there are several companies that have devices that are commercially available. They usually, they need to pass the safety measures and that, preliminary safety measure. Now, different devices have different level of evidence, and that's something that the consumer need to look at. At this point, there is no device that, as physicians, we would prescribe for a particular condition. So these are not kind of clinically prescribed type of devices at this point, and for to treat different mental health conditions.
Yeah. I mean, what I always advise people, and tell me if you agree, is go to the website of the company and see if they've got any studies that are listed. Look over those studies very carefully. If there's no studies, then maybe, wait for some studies to get done.
Yeah, I mean, if there are studies, usually companies will put them up there and discuss with your healthcare providers and have to help you understand the studies and the nature of them. So that's always a part of a discussion. Yeah.
So, as we come to a close, we always want to leave our audience with actionable tips. So, given our discussion today, what are the top 3 tips or resources you would recommend for our audience to do after they listen to today's episode?
Well, I think one key message I would say, especially in the field of neuromodulation and the link between the mental health and dementia and cognition, is participate in research studies, join research studies. I think that's the way to advance our knowledge and lead us to the new forms of treatment that would be available. And participate not only as a participant, but you could also participate in co-designing with scientists the new forms of treatment, the new form of trial. So I know in CABHI and TDRA, there are very robust councils that include people with lived experience who participate in the design of our research studies. And check our website, check the tdra.utoronto.ca.
Thank you, Tarek, for joining us on today's podcast.
Thank you, Allison, very much. It's been a pleasure. Thank you for having me.
To learn more about Dr. Tarek Rajji and his work, you can visit tdra.utoronto.ca. Now that we've learned about brain stimulation from a clinician's perspective, we've got the opportunity to hear from a client's perspective. And as Rosanne mentioned at the start of the episode, we're thrilled to welcome Fatima, who's a person who's experienced brain stimulation for treatment of neurocognitive disorder.
Fatima is a person with lived experience of brain stimulation from Mississauga, Ontario. She participated in a brain stimulation study with the Centre for Addiction and Mental Health and hopes to have the chance to participate in other research opportunities. Her biggest hope is that through these studies, she will leave with positive outcomes for her own mental health as well as for the mental health of others.
Fatima, thank you so much for being here with us today in honor of Mental Health Awareness Month.
My pleasure to be here.
Can you tell us a little bit about your health and how you came to brain stimulation as a treatment?
Initially, I had some mental problem, and I was diagnosed with a neurocognitive disorder. So the psychiatrist that was treating me referred me to this study, and I accepted, and I was very happy to go through it.
So, Fatima, what were your first thoughts when they mentioned brain stimulation to you?
My first thought was I was a little concerned about having pain. How much pain do I have to go through? And then in the end, there was no pain at all. That totally the opposite was a relief.
It's amazing. Can you walk us through what a brain stimulation session is like for you?
Okay, my first initial step when you walk to the room was very a lot of equipment, and you feel a little bit intimidated. But then when they start to apply those cap and wires, and then you start to feel that sensation on your brain, on your head. I felt really good, and I felt very secure. Then I didn't feel pain at all. So my initial fear went away. And as I carry on with my section, the better I felt and relieved from all my head pain.
And so the second time you went, you didn't have as much fear going into it because you knew what to expect, yeah?
Yeah, that's correct.
So, if you're comfortable sharing, what were some of the effects or outcomes that you experienced after the treatment?
The initial, when I started to have this stimulation, the pain was one way. And then as I finished the whole section, so my headache was in another way. So the pain went to another part of the head. So was more relief. So now after this section, I have a headache, but not as bad as before and not every day as before.
How long did those effects last?
When I get out of the treatment or like the stimulation section, right away there was no pain, and then it take about 2 days. Then from the last one, which was amazing, it lasted me about 2 weeks without that pain. So I wish I could go back to that, but doesn't happen.
Did anything surprise you while you were undergoing your brain stimulation?
Yes, it made me really happy. Every time I go to the section, I was so excited and happy because I knew it that something was going to happen to my headache, and it did. The more I did it, the less headache I had.
That's amazing. And what would you say to other people who might be considering brain stimulation?
Go ahead, do it as much as you can, because there is a good side effect, a positive one.
So, Fatima, what would you want to tell our audience about your story and mental health, because it's Mental Health Awareness Month?
What I wanted to say is that to have always someone to guide you, to look after you, because if you don't have somebody to back you up or to help you, it's going to get worse and worse. And when I initiated my treatment was one stage. And now I know it's not going to go away, but it's slowing down the process. And I think by slowing down the process and carry on with your age, it's a blessing, because the older you are, it's going to happen, but I'm still, have some time to walk that path.
Fatima, you participated in research, this study you told us about. What would you want other researchers to know?
I really wish and hope that the study that is being done could help many, many of us that is going through this situation, because we have times that no words can help us, and understand what is going on with your brains, and relying on the professional fields to help us. I strongly believe and I hope that this team, this group, come to help us, because eventually we're going to depend totally on you.
And we're so happy that you found some comfort in the neurostimulation work that you're doing. Well, thank you so much, Fatima, for joining us here today. It's a blessing to have you here. So thank you for sharing your inspiring story in honor of mental health awareness. Thanks for being here.
Thank you. My pleasure, doctor.
Fatima joins us from Mississauga. Thank you to both Tarek and Fatima for joining us on the pod. Once again, to learn more about Dr. Tarek Rajji's work, you can visit tdra.utoronto.ca. And we also want to thank our podcast production team, including Rhea Singer, Katie O'Connor, Tommy Lamb, and our friends over at Podtex.
To learn more about CABHI, please visit us at CABHI.com. That's CABHI.com. We'd also love your support of our podcast, so be sure to follow us and leave a review on SoundCloud, Spotify, Apple Podcasts, YouTube, or wherever you get your pods.